So today we want to know how to do the simple continuous suturing or the simple uninterrupted suturing. Usually the one that we can do for a perineal tear in the labor ward. So how do you do it? Let's look at it. So assuming that we are done giving the lidocaine injection, like if you have watched my previous video, you know how to go about giving the lidocaine injection. Now we are done washing, cleaning it. So we have our approved instrument, the needle holder, dissecting forceps, a 2-to-1, and the surgical or the surgeon scissors, or sometimes you can even use a stitch or a cutting scissors. And in this suture, you are going to use the Velcro suture. Some people may even prefer using the chromic, but I'm going to use the Velcro suture. So how do you do the simple continuous suturing? So with this one, once you start, you're not going to cut until you reach the ending point. Then what you cut before you are done with this suturing type. So you start from within. You start from within like this. So how you see it? So you start from within. So you pick within the walls of the tissue like this, and then you come out. Then you come and also go through the other side of the wall. So you make sure that in the initial stage you stay within the cut before you be able to come outside, and then you come and continue with the same one. So as it was done previously, the surgeon's knot twice, 1, 2, 1, 2, yeah, 1, 2, and then what? You tie it. Subsequent ones, or what? Once, 1, another what? 1. Then you are good to go. So then you can cut this short piece here. Now you are good to go. So sometimes, because it's not easy for you to maneuver your hands once you want to do the inside before you come outside, that's how come sometimes I'm not using the dissecting forceps. So you come and continue like this. So you stay within the walls of the cut or the tissue. So can you see it? Like this. You stay within the walls of the cut till you reach this end, and you come and continue from the outside. It's not a difficult type of suturing, but with experience or following through some principles or guidelines, you'll be able to do it at your own unit, or when you encounter such a situation where a patient sustains a perineal tear, especially with those who first time delivery, that's the primary gravida. So once you are nearing the end point like this, and then you try to come outside. You try to come outside. So have you seen that still I'm within the walls of the cut? So that by the time that I'm done with this suturing, the base too will be able to oppose well, preventing any hematoma formation from forming beneath this cut. So now I can come outside and like this. So then I'm trying to come outside. If you can see well. So I'm trying to come outside. So I'm still within it, and I'm trying to come outside, and then I'll come and continue till I reach this end here. So I hope you can see me. You can see what I'm doing. So have you seen it? So now the needle is out. So now this is the simple continuous or the simple uninterrupted suturing that usually is being done or performed for those who sustain a perineal tear. So you can see it. So the initial stage, you stay within the walls of the cut, then you try continuously, and then you come outside, you come and continue till you reach this end here. It's not difficult. With continuous practice, you can also do it. So have you seen it? Have you seen it? Yeah. Then once you reach the end point like this, assuming that we are ending, like we've reached the end point. So how do we tie the knot or make the knot? So once you take a bite like this, don't pull all through. So then with this leftover, then you start 1, 2, you come and hold this part here, then what? So have you seen it? So the second knot just once, and the last one just once. So you are done. Now you can cut it. So this is what we call the simple continuous suturing, or the simple uninterrupted suturing, usually that we do for what? Those who sustain a perineal tear in the labor ward. Thank you.